The word synthetic is misused very frequently, and it's a loaded term that scares a lot of people. But the truth of the matter is that there are thousands of synthetic drugs. The vast majority of pharmaceuticals really the entirety of pharmaceuticals that people use are synthetic. Even, drugs of plant or botanical origin are synthetic in the sense that they are biosynthesized by a plant. So arguably everything is synthetic. But generally in this discussion, when people talk about synthetics, they're referring to newer chemicals that have a shorter history of human use. And just because they're new or because they don't occur in a plant doesn't necessarily mean that they're dangerous. It's just something that frightens people for whatever reason.
Do you think it frightens people because we hear of more people dying because of, quote, chemical overdoses? I mean, some of the hardest narcotics after sort of the drug craze of the 60s, cocaine, heroin, are considered to a degree chemicals. So therefore, anything chemical for recreational purposes is sort of demonized or has a stigma attached to it.
Right. I mean, cocaine, of course, is a non-synthetic compound. It is isolated from coca leaves, so it is a botanical drug.
Initially, it's initially from coca leaves, but then it's cut and it's mixed with chemicals for distribution. No, am I wrong?
It is, yes, but and that's become more of an issue in recent years with the levamisole contamination in a lot of cocaine samples. But in the 80s, it really was primarily cocaine in samples that were seized, and so that is an example of something that is completely natural and still may have been involved in some social problem. So I think it's definitely a mistake to assume that the problem is that these drugs are synthetic. That's not the issue. The issue is that they are generally sort of untested compounds that are used recklessly by people, and that's the issue. Even the most recent publicized deaths at this electric music or EDM festival in New York, these people that died, they were using a drug called methadone that everyone is treating it as if it's a very new drug, but it's not. It's been used for at least a decade, if not longer, and it's actually a relatively safe compound. But if you use 8 or 10 times the therapeutic dose, people start having adverse or even fatal responses to the compound. That's just what happens.
The drug methadone that you're talking about, is that a form of MDMA? I mean, is it what people are calling Molly, or was it a different version of these things that or was it a different chemical that has the same sort of effects as Molly or MDMA?
Well, MDMA is a specific chemical that is a single molecule, whereas this is a related compound. It's beta-keto MDMA. It was patented by a very important chemist named Alexander Shulgin in 1996 for use as an antidepressant, and it definitely has some pharmacological similarities and some chemical similarities, and from the perspective of the user, there's some experiential similarities as well, but it's a different compound, and it has a more narrow therapeutic index. It's a little bit less safe, probably, although I think, as I said earlier, it's a relatively benign substance, and so because it hasn't been as carefully tested and people are using it recklessly, yes, there have been some adverse reactions, but that happens with really any drug once it's introduced to a large enough population of users.